Dear colleagues, welcome to our PNF video. The PNF patterns are a central component of the PNF concept. They are basically a treatment tool and not a therapy in itself. The selection of the patterns depends upon the specific functional problem of the patient. In this video, we are presenting the scapular and pelvic patterns in side lying and the extremity patterns in supine. It is easy to familiarize yourself with these patterns using these positions. Each pattern is first introduced without a therapist. Here the flow of the movements and their alignment relative to the body diagonal are demonstrated. For the extremity patterns, the timing of the single movement components is described also. Following is the demonstration by the therapist. The PNF-specific grip is applied with lumbrical position of the hand. This means that the metacarpophalangeal joints are in a flexed position, while the proximal and distal interphalangeal joints remain extended. Depending on the pattern, the thumb can be opposed or adducted. In this video, we will demonstrate the grips that we have found most successful in our patient treatments. For optimal facilitation, the body mechanics of the therapist is of great importance. His position relative to the patient and his dynamics during a pattern are greatly influencing the proprioceptive stimulus for the flow of the pattern. The pattern starts with elongation of the muscle chain and moves in a straight line or parallel to the imagined body diagonal to the final contracted position. The initial stretch is a short additional elongation of the muscle chain. Its application facilitates the start of a pattern by quicker stimulation of motor units. Now, let's get a treatment table ready and the remote control within reach. The pause button will allow you individual learning pace. We hope you enjoy our video and have fun practicing the PNF patterns. Scapular patterns. Anterior elevation. The scapula moves in a steep alignment from posterior depression to anterior elevation. The final position is just ventral of the lateral midline. Demonstration.
Okay, and pull up and relax. And pull up your shoulder and relax. And pull up, pull, and pull up. Fine.
Grips. Both hands are in a lumbrical position and are placed on top of the acromion and distal part of the clavicle. Body mechanics.
And pull up.
To allow a smooth scapular movement, the therapist has to shift weight onto his front leg.
And pull up. Good.
In the groove.
And pull up relax. And pull up your shoulder, fine. And pull up, pull harder, good. And pull up, relax.
Initial stretch.
And pull up.
The elongation and the initial stretch are achieved by shifting the weight onto the back leg.
And pull up. And pull up.
Posterior depression. The scapula moves in a steep alignment from anterior elevation to posterior depression. The final position is just dorsal of the lateral midline. Demonstration.
Okay. And push down your shoulder. Fine. And push down. And relax. And push down your shoulder. Push more. And relax. And push down. Push harder. Fine.
Grips. The hands are placed overlapped on the scapula. One hand is cupping the inferior angle, while the fingertips of the other hand are pushing against the lateral end of the spine of the scapula. One hand is cupping the inferior angle, while the fingertips of the other hand are pushing against the lateral end of the spine of the scapula. Using this type of grip application, it does not matter which hand is placed on top.
And push down.
Body mechanics.
And push down. Good.
Weight shifting onto the back leg is as important as the simultaneous stabilization of your own spine.
And push down harder. Fine. And push down. Good.
In the groove.
Well, and push down. Good. And push down. Push harder. Relax. And push down. Push. Fine. And push down. Good.
Initial stretch.
And now, push down, push, and push down.
The elongation and initial stretch are achieved by anterior weight shifting.
And push down,
Posterior elevation. The scapula moves in a steep alignment from anterior depression to posterior elevation. The final position is just dorsal of the lateral midline. Demonstration.
And pull up. Fine. And pull up your shoulder. And pull up. Relax. And pull up.
Grips. The hands are placed overlapped onto the supraspinatus fossa.
And pull up. And pull up your shoulder.
Body mechanics.
And pull up your shoulder.
It is important to keep a straight back. The knees must remain flexed.
Pull up. Fine. And pull up. Good.
In the groove.
Okay. And pull up your shoulder. Relax. And pull up your shoulder. Pull harder. Relax. And pull up. Fine. And pull up. Pull. Good.
Initial stretch.
Okay. And now. And pull up.
The initial stretch is achieved by additional weight shifting. Elongation, stretch, and resistance.
And pull up. Fine.
Anterior depression. The scapula moves in a steep alignment from posterior elevation to anterior depression. The final position is just ventral of the lateral midline. Demonstration.
Okay. Pull down your shoulder. Relax. Pull down and relax. Pull down. Good. And pull.
Grips. The dorsal grip is positioned at the lateral border of the scapula. The fingers of the other hand are placed caudal from the coracoid. Body mechanics.
Okay. And pull down your shoulder.
The therapist starts from a slight squatting position and adapts himself to the scapular movement by weight shifting. The lower arms of the therapist are always pointing in the direction of the scapular movement.
And pull down. Good.
In the groove.
And pull down. And pull down. Relax. Pull down your shoulder.
Initial stretch.
Well, and pull down your shoulder.
The initial stretch is achieved by additional weight shifting. Elongation, stretch, and resistance.
And pull down. Good.
Arm patterns. Flexion, abduction, external rotation. The pattern is starting in the body diagonal. The arm is moving in the groove into flexion, abduction, external rotation. Normal timing. Starting position, followed by finger extension and abduction, dorsiflexion, radial abduction and supination, merging into external rotation of the shoulder with flexion and abduction. Starting position, followed by finger extension and abduction, dorsiflexion, radial abduction and supination, merging into external rotation of the shoulder with flexion and abduction. Demonstration.
Wrist up and pull up. Open your hand and pull up. Open your hand and pull up your arm. Open your hand and pull. Good.
Grips. The proximal grip is placed midway on the lateral side of the upper arm. Use traction. The distal grip is in a lumbrical position on the back of the hand. Proximal grip on the upper arm. Distal grip on the back of the hand. Body mechanics.
Open your hand and pull up. Good.
The elongation is starting from the legs of the PT and is emphasized by leaning the upper body forward. In the following demonstration, the therapist starts to turn on his right leg. He is adapting to the arm movements by shifting his weight. Elongation is starting from the legs, leaning forward, rotation, and weight shifting.
Open your hand and pull up.
In the groove.
Wrist up and pull up your arm. Okay. Wrist up, pull up. Wrist up and pull. Wrist up and pull up your arm. Good.
Initial stretch.
And wrist up and pull.
The initial stretch is achieved by additional weight shifting onto the right leg.
And wrist up and pull up. And pull up.
Extension, adduction, internal rotation. The pattern is started in the imagined extended body diagonal. The arm is moving in the groove in extension, adduction, internal rotation, thereby crossing the body midline. Normal timing. Starting position, followed by flexion of the fingers with palmar flexion, ulnar abduction and pronation, continuing with internal rotation of the shoulder, extension and adduction. Starting position, followed by flexion of the fingers with palmar flexion, ulnar abduction and pronation, continuing with internal rotation of the shoulder, extension and adduction. Demonstration.
Squeeze and pull down. Squeeze and pull down. Squeeze my hand and pull down. Squeeze and pull. Good.
Grips. The proximal grip is placed medial on the upper arm. Use traction. The distal grip is lumbrical into the patient's hand. Proximal grip, medial on the upper arm. Distal grip, lumbrical into the patient's hand. Proximal grip, traction, distal grip. Body mechanics.
Squeeze and pull down.
The elongation is started in the legs and achieved by shifting the weight onto the left leg. The following rotation of the therapist is synchronous with the pronation and internal rotation of the patient's shoulder. The therapist is aligned behind the arm and adapting to the movement by shifting his weight.
Squeeze and pull down.
In the groove.
Squeeze my hand and pull down. Good. Squeeze and pull down. Squeeze and pull. Squeeze and pull down. Good job.
Initial stretch.
And squeeze.
The initial stretch of the elongated muscle chain is achieved by shifting the weight onto the left leg.
And squeeze. And pull down.
Flexion, adduction, external rotation. The pattern is started in extension parallel to the body diagonal. The arm is moving along this parallel line in flexion, adduction, external rotation, thereby crossing the body midline. Normal timing. Starting position, followed by flexion of the fingers with palmar flexion, Radial abduction and supination. Continue with flexion of the shoulder with adduction and external rotation. Starting position, followed by flexion of the fingers with palmar flexion, radial abduction and supination. Continue with flexion of the shoulder with adduction and external rotation. Demonstration.
Squeeze my hand and pull up. Squeeze and pull up. Good. Squeeze and pull up. Squeeze and pull up. Good job.
Grips. The proximal grip is placed medial and ventral on the upper arm. The distal grip is lumbrical into the patient's hand. Continue with elongation. The proximal grip is placed medial and ventral on the upper arm. The distal grip is lumbrical into the patient's hand. Continue with elongation. Body mechanics.
Squeeze and pull up.
The elongation is started in the legs and achieved by shifting the weight onto the right leg. Traction, weight shift. The following rotation of the PT is a result of the patient's supination. With increasing flexion and adduction, the weight is shifted onto the left leg.
Squeeze and pull up.
In the groove.
Squeeze and pull up. Good. Squeeze my hand and pull up. Squeeze and pull. Squeeze and pull up. Good job. Squeeze and pull up. Squeeze and pull up. Squeeze and pull up. Squeeze and pull.
Initial stretch.
And squeeze. and pull up.
The initial stretch is achieved by additional weight shifting onto the right leg.
And pull up. And squeeze and pull out.
Extension, abduction, internal rotation. The pattern is started in flexion parallel to the body diagonal. The arm is moving along this parallel line in extension, abduction, internal rotation. Normal timing. Starting position, extension and abduction of the fingers, dorsiflexion, ulnar abduction, and pronation, followed by internal rotation, extension, and abduction of the shoulder. Starting position, extension and abduction of the fingers, dorsiflexion, ulnar abduction, and pronation, followed by internal rotation, extension, and abduction of the shoulder. Demonstration.
Wrist up and pull down. Wrist up and pull down. Pull more. Open your hand and pull. Wrist up and pull down.
Grips. The proximal grip is midway on the lateral dorsal side of the upper arm, traction. Distal grip is lumbrical on the back of the hand. The proximal grip is midway on the lateral dorsal side of the upper arm. Traction. Proximal grip. The distal grip is lumbrical on the back of the hand. Body mechanics.
Open your hand and pull down.
The elongation is started in the legs in mid-position and then achieved by leaning the upper body forward and weight shifting. After starting, the PT turns himself synchronous with the pronation and increases weight shifting onto the right leg. Traction, elongation by weight shifting, turning, and weight shifting. In the groove.
Open your hand and pull down. Open up your hand and pull down. Wrist up and pull. Wrist up and pull. Open your hand and pull down. Open your hand and pull.
Initial stretch.
And wrist up and pull.
The initial stretch of the elongated muscle chain is achieved by shifting the weight onto the left leg.
And wrist up and pull down. And wrist up.
Pelvis patterns. Anterior elevation. With this pattern, the lateral flexion is the main movement component. Rotation and flexion are less pronounced. Demonstration.
Okay, and pull up your pelvis. Good. Okay, and pull up. Good. And pull up. Good. And pull up. Okay.
Grips.
The hands are placed overlapped with lumbrical tension on the anterior aspect of the iliac crest. Both hands lumbrical on the anterior aspect of the iliac crest. Body mechanics.
Okay, and pull up your pelvis.
It is important to stabilize your own spine, to shift your body weight, and utilize your own body weight while exerting resistance.
And pull up.
In the groove.
And pull up your pelvis. Good. And pull up. Okay. Again. Pull up. Good. And pull up. Pull. Good.
Initial stretch.
And pull up. Good.
The initial stretch is given by an additional weight shift onto the back leg.
And pull up. Good. And pull.
Posterior depression. With this pattern, the lateral flexion is the main movement component. Rotation and extension are less pronounced. Demonstration.
And push down. And sit into my hands. Okay. And push down. Good. And push. Okay.
Grips. The hands are placed overlapped with lumbrical tension on the ischial tuberosity.
And push down.
Body mechanics.
And push down. Good.
The PT adapts his body mechanics to the movement of the pelvis.
And push down. And push down.
In the groove.
And push down your pelvis. Okay? And sit into my hand. Good. And push down. Okay? And push down. Good.
Initial stretch.
And push down. Good.
The initial stretch is given by an additional weight shift onto the front leg.
And push down. And push down.
Posterior elevation. With this pattern, the lateral flexion is the main movement component. Rotation and extension are less pronounced. Demonstration.
Okay. And pull up your pelvis. And pull up your pelvis more. Fine. And pull up your pelvis. And pull up. Good.
Grips. Both hands are placed overlapped on the posterior aspect of the iliac crest. Body mechanics.
Okay. And pull up your pelvis.
The treatment table should be set to a higher position to enable the PT to move his forearms in accordance with the pelvic movement. The knees and hips should not be locked in position.
Pull up your pelvis. Good.
In the groove.
And pull up. Good. And pull up your pelvis more. And relax. And pull up your pelvis more. Good. And pull up.
Initial stretch.
Okay. And pull up. Good.
The initial stretch is given by an additional weight shift onto the front leg.
And pull up. Good. And pull up.
Anterior depression. With this pattern, the lateral flexion is the main movement component. Rotation and flexion are less pronounced. Demonstration.
Okay, push down your pelvis. And push down your pelvis and relax. Okay, and push down your pelvis more. Good. And push down your pelvis and relax.
Grips. One hand is placed on the anterior superior iliac spine. The other hand is placed caudal on the ischial tuberosity. Body mechanics.
And push down your pelvis and relax.
The PT moves in the groove and adapts his body mechanics in accordance to the pelvic movement.
Push down your pelvis. Relax. And push down your pelvis.
In the groove.
And push down your pelvis. And relax. Okay, and push down your pelvis. Fine. And push down. Good. And push. Push harder. Good.
Initial stretch.
Now let's start. And push down. Good.
The initial stretch is given by an additional weight shift onto the back leg.
And push down. Okay. And again, push down.
Leg patterns. Flexion, adduction, external rotation with knee flexion. The pattern starts from the extended body diagonal. The knee moves in a straight line to the contralateral shoulder. The heel is crossing the midline of the body more than the knee does. Normal timing. Starting position, toe extension and dorsiflexion with supination. External rotation of the hip, knee, and hip flexion with adduction. Starting position, toe extension, dorsiflexion with supination, external rotation of the hip, knee, and hip flexion with adduction. It is important that the knee and hip flexion are synchronized. Demonstration.
Well, toes up and bend your knee. Okay. And toes up, bend your knee. And relax. Okay, and pull up. Good. And again. And pull up and bend your knee.
Grips. The distal grip is lumbrical on the dorsal foot. The thumb is placed laterally on the distal end of the fifth metatarsal. The hypothenar is placed along the metatarsophalangeal joints. Proximal grip, ventral and medial on the thigh. Resistance.
And pull up, bend your knee.
The distal grip has three functions. First, it provides the distal components with resistance. Secondly, through traction of the foot away from the ischial tuberosity, it stimulates the knee flexor muscles. And finally, it provides resistance for the external rotators of the hip. The proximal hand applies resistance for flexion, adduction, and external rotation of the hip. Body mechanics.
And toes up, bend your knee.
To achieve optimal elongation, it is necessary to position the leg in internal rotation before bringing it to the starting position. The leg is then positioned in the groove while maintaining traction. It is important to apply the traction through shifting weight onto the back leg while maintaining a stabilized back. When applying the pattern, the PT utilizes his body weight to provide resistance. Therefore, muscular fatigue is minimized.
And toes up and bend your knee.
In the groove.
Okay, toes up, bend your knee, and pull. Good. And toes up and pull. Fine. And toes up, bend your knee, pull harder. Good. And toes up and pull. Good.
Initial stretch.
Okay, and toes up and bend your knee.
The initial stretch is given by an additional weight shift onto the rear leg with an increased traction and internal rotation.
And toes up and bend your knee. Pull and pull up, bend your knee.
Extension, abduction, internal rotation with knee extension. The pattern starts in flexion, adduction, external rotation with a bent knee. The leg moves in a straight line to the end position, which is exactly the extended body diagonal. Normal timing. Starting position, toe flexion and plantar flexion with pronation. Internal rotation, hip and knee extension with abduction. Starting position, toe flexion and plantar flexion with pronation, internal rotation, hip and knee extension with abduction. It is important that the knee and hip extension are synchronized. Demonstration.
Okay. Toes down and straighten your knee. And toes down and push. Good. And relax. And push down. Harder, push harder. Good. And relax. And toes down and push. Fine.
Grips. The distal grip is placed in a lumbrical position on the plantar surface of the forefoot. The thumb is placed along the metatarsophalangeal joints. The proximal grip is placed with an open palm on the dorsolateral area of the thigh. Resistance.
Okay. And toes down and straighten your knee. Good.
The distal grip has three functions. First, it provides the resistance for the distal components. Secondly, it applies pressure in the direction of the ischial tuberosity in order to stimulate the knee extensors. And finally, it provides resistance to the internal rotators of the hip. The proximal hand applies resistance for extension, abduction, and internal rotation of the hip. Body mechanics.
And Toes down and straighten your knee.
By leaning forward, the PT achieves the elongation. With this pattern, the resistance is applied primarily by the body. When stepping backwards, it is important to stabilize the back. Elongation, step with a stabilized back. In the groove.
And toes down and straighten your knee. And relax. And push down. Straighten your knee. Good. Toes down and push. More. Good. And push down. More. Good.
Initial stretch.
Okay. And push down and straighten your knee.
The initial stretch is given for all movement components through an additional weight shift onto the front leg.
And push down and straighten your knee. Relax. And toes down, straighten your knee. Good.
Flexion, abduction, internal rotation with knee flexion. The pattern starts in extension adduction, external rotation with knee extension. The knee moves in a straight line parallel to the body diagonal. Normal timing. Starting position, toe extension with dorsiflexion and pronation, continuing with knee and hip flexion with abduction, internal rotation. Starting position, toe extension with dorsiflexion and pronation, continuing with knee and hip flexion with abduction, internal rotation. It is important that the knee and hip flexion are synchronized. Demonstration.
Okay. And toes up and bend your knee. And toes up and bend your knee. Okay. And toes up. Good. And toes up, bend your knee. Good.
Grips. The distal grip is placed lumbrical on the dorsal foot. The proximal grip is positioned ventral and lateral on the thigh. Resistance.
And toes up and bend your knee.
The distal grip has three functions. First, it provides the resistance for the distal components. Secondly, through traction of the foot away from the ischial tuberosity, it stimulates the knee flexor muscles. And finally, it provides the resistance to the internal rotators of the hip.
Toes up.
The proximal hand applies the resistance for flexion, abduction, and internal rotation. Body mechanics.
And toes up and bend your knee.
In order to achieve optimal elongation, it is necessary to position the leg in external rotation before bringing it into the starting position. Then the leg is positioned in the groove while maintaining traction. When applying the pattern, the PT steps across and backwards. Elongation and crossing backwards. In the groove.
Okay. And toes up and bend your knee. Good. And toes up and bend your knee. Okay. Again. Toes up and bend your knee. And toes up and bend your knee.
Initial stretch.
And toes up and bend your knee.
The initial stretch is given by an additional weight shift upon the front leg with an increased traction and rotation.
And toes up and bend your knee. And toes up and bend your knee.
Extension, adduction, external rotation with knee extension. The pattern starts in flexion, abduction, internal rotation with a bent knee. It moves in a straight line parallel to the body diagonal. While moving, the patient's leg crosses the midline of the body. Normal timing. Starting position, toe flexion, plantar flexion with supination, external rotation, hip and knee extension, adduction. Starting position, toe flexion, plantar flexion with supination, external rotation, hip and knee extension, adduction. Demonstration.
Okay. Toes down and push down and in. Good. Again. Toes down and push down and in. Good. Toes down and push. Good. And toes down, push down. Good.
Grips. The distal grip is placed lumbrical on the plantar surface of the forefoot. The thumb is placed along the NTP joints. The proximal grip is positioned on the dorsal medial thigh. Resistance.
Okay. Are you ready? Toes down and push down.
The distal grip has three functions. First, it provides resistance to the distal components. Secondly, with pressure in the direction of the ischial tuberosity, it stimulates the knee extensors. And finally, it provides resistance to the external rotators of the hip. The proximal grip provides resistance for hip extension, adduction, external rotation. Body mechanics.
And toes down, heel in and push down.
The elongation is achieved by leaning backwards. During the external rotation, the PT steps forward with his right leg. Here, it is important that the PT maintains his body weight on his back leg for the first part of the pattern, thereby effectively utilizing his body weight to apply resistance. Elongation and step. In the groove.
Okay. Toes down, heel in and push down. Good. And toes down and push down. Good. And toes down and push down. Okay. And toes down, heel in and push.
Initial stretch.
Okay. And toes down and push down.
The initial stretch is provided by an additional weight shift to elongate all components of the pattern.
And toes down and push down. And toes down and push.